Good afternoon, this is Jackie Bainbridge talking to you today about an exciting topic, multiple sclerosis, which I'll abbreviate as MS throughout this presentation. The formal name of this activity is Therapeutic Updates, Best Practices, and Barriers to Care in the Prevention and Treatment of Multiple Sclerosis. This is a 1-hour CE presentation. My disclosures are listed. Learning objectives are there for your edification. We will be discussing each of these points. Let's begin with the basics. Multiple sclerosis, or MS, is a chronic inflammatory disease that's really characterized by two phases, myelin destruction and axonal damage. Once you have axonal damage, or the axon is severed, it will not regenerate. Myelin destruction, and myelin, remember, is that fatty protective sheath that goes around the nerve. That can actually start to become destructed, but then you can actually regenerate myelin around that nerve or throughout that myelin. So that actually can be regenerated, but axonal damage is permanent. These phases actually occur probably simultaneously, and we used to believe that this occurred later in the disease state, but now we're thinking that that actually begins right at the very beginning of the disease process. Multiple sclerosis really refers to two specific characteristics of the disease. One, there are numerous affected areas in the brain and spinal cord that produce multiple neurologic symptoms that accrue over time. So there are multiple white matter lesions that are seen in the central nervous system. You also see, and those plaques are actually sclerosed areas, and that is the hallmark of the disease. So you have sclerosed multiple plaques throughout the central nervous system. White matter mostly affected, but gray matter is also affected in multiple sclerosis. When you think about the cases of multiple sclerosis in the world, you actually find that about 2.7 million people have the disease. More than 400,000 American people actually have a diagnosis of multiple sclerosis. And unfortunately, 200 new cases of MS are diagnosed each week in the United States. It's really the second most common cause of neurologic disability in the United States. And 80% develop between the ages of 16 and 45 years of age. However, now we're realizing that that window is actually stretching on either stage. So we actually have children in our practice, 8-year-olds, 10-year-olds that actually have a formal diagnosis of MS. And people are actually being diagnosed into their 50s now. But the mainstay, or most people, will develop it between the ages of about 16 and 45. Females are affected more so than males at about 2.4 to 1 ratio. And if you look at patients, if they're untreated, about 50% of people will require a cane or an ambulatory support device within 10 years of onset of the disease state, and about 30% of patients will become wheelchair-bound or bed-bound even. And those patients who are untreated really have a lifespan decrease of about 5 years or even less. Across the board, health-related costs are about $48,000 per patient per year, which is a lot of dollars. Leading cause of non-traumatic disability in young women, and the second leading cause of disability in young men in the United States. Important to recognize is that many of these people are being diagnosed in the time of their lives when they're really they're earning money, they're in college, they're enjoying their life. So depression is quite high in this disease state, and suicide is actually 6 to 7 times more likely in the MS patient population than in controls. We don't really know what causes multiple sclerosis. Many people believe that it's a combination of factors, including a genetic predisposition, altered immune system, so something allows this to be turned on in the body. Also, an environmental factor that may be important. So there could be a component of measles, mumps, rubella, and if you look at autopsies brains from patients with MS, not in all brains, but in many brains, you'll actually find the Epstein-Barr virus or herpes simplex virus 6. that are recovered in many brains.